Welcome back, everybody. 6:45 this morning, 7 Eyewitness News taking you in depth, talking about new restrictions New York State is putting in place. It's all in hopes of stopping a rise in COVID-19 cases. Look at these numbers this morning. Inside Erie County's yellow zone, the infection rate is up to 8.1%. That's in that yellow zone. It is more than 4% for the rest of Western New York.
Governor Kathy Hochul. She joins us live by Zoom. Lieutenant Governor, good morning to you. Thanks so much for being with us. Let's get right to it. We don't have a lot of time and a lot of questions here this morning. We're talking about the impact here on gyms, bars, restaurants. They now all have to close at 10 o'clock. And we're also learning that no more than 10 people are suggested at private gatherings. How does this help?
Well, it helps in an enormous way. First of all, and thank you for having me on the show to explain this. We have found from our contact tracers, the people who have conversations with those who tested positive, where they got the virus from. And we're finding since Halloween, there are a lot of parties or people gathering for Bill's party. It is now occurring more likely in people's homes and their own private gatherings where people take the masks off and they feel like, well, if this is my friend or this is my relative, of course they wouldn't have the virus. And in fact, they do. The fact that our yellow zones in Erie County are 8%, that is extraordinarily high. And if we don't stop this spiraling out of control, we would have to have more shutdowns, which is what we're desperately trying to avoid. So the limitations on restaurants and bars shutting down at 10 o'clock, same with gyms, those are our areas where we're concerned about spread, but it's also in the family home now. And that's where we're asking you to be very vigilant and careful as we head into this holiday season.
Okay, so on one hand, like I'm one of those people, I'm not going to see my family. They live out of state. I'm staying home for Thanksgiving. On the other hand, you've got the people who are saying, you can't limit the number of people who are coming into my house. And if the health department shows up and says, knock, knock, health department, they're going to say, where's your search warrant? So how do you enforce this?
You know, and it shouldn't get to this. We're living through a pandemic. This is not arbitrary. This is based on our desire to not have to have the wholesale shutdowns where everybody was told to stay home. Remember that in March and April, only come out for a walk and get some fresh air, try to avoid everything but the grocery store. We don't want to go back to that. And we cannot afford to have that happen to our economy again. So everybody has a role to play, particularly in your home where you have control. You could be making sure that if you do have someone over, that they're wearing the mask or socially distanced. And it just hasn't been working. So we need to have a little teeth now, and it's not any place I wanted to go or the governor wanted to go. We liked our numbers back in the summer when everybody was following the rules. We were down to 1%, 1.5%, and now we've gone up to 8%. That's not acceptable. That means a lot more people are going to be getting sick, and they're going to end up in hospitals. And we've worked too long and too hard to avoid a scenario of a massive shutdown. So these are incremental measures, and we're asking people for their full cooperation, or else we're not going to get there.
So let me just put it to you this way. I got a call from a lady the other day who lives in Clarence, and she said to me, I can't imagine that the state is limiting the number of people, a family of 5 at a restaurant table, yet she can go to a restaurant and sit with 3 strangers for all intents and purposes. So really, is this actually helping, or is this just putting more restrictions on New Yorkers?
It's just, well, don't just say New Yorkers, because we're doing exactly what's being done in all the states around us. We're surrounded by states with much higher statewide infection rates, Connecticut, New Jersey, Pennsylvania. And we will end up like them if we don't follow restrictions. Everything we're asking New Yorkers to do right now is being done by surrounding states based on what experts are saying are the ways that we can control this before it gets to a point where there's widespread infection rates throughout the community, and then you just can't control it. And then the hospitals become over. We all have those horrible images of what's happening, not from months ago, but in the Midwest and North Dakota and in Texas, El Paso, where one out of 30 people have the infection. Right. That could be us. We're just asking New Yorkers, hang in there with us. You've done a great job up until now, but don't become complacent. Don't have COVID fatigue, because this is our dangerous time with indoor dining, more likely people staying indoors for the holidays, and just be really smart about this. The vaccine is out there. It's on the horizon. We can get through this until that time when we can have everyone vaccinated and then put an end to this sorry chapter in our history. But it's not just New York. It is going on all over this country and all over the world.
I totally get that. I have a couple of seconds left here. I want to know when we can get out of the yellow zone. What will it take, and how are you monitoring that briefly?
Well, we're monitoring closely, and I'll tell you, I don't want to go out of it and head into the orange zone or the red zone. And that's what's next if people's behavior doesn't change very quickly. And it's hard to be so stern about this, but we have to be. I want to
Okay.
go out of it and head down to nothing, but we're going to be watching the numbers close. There's not one set number, but I do know we're very close to being in an orange zone if the behavior doesn't change and the numbers don't start going down. And that's when we have non-essential businesses closed. We have a lot more restrictions. It's going to hurt the restaurants and bars. We do not want to do that.
Right.
So
No one
please,
wants that.
everybody, please don't let that happen. You
Okay,
have the
so-
power.
Let's talk about that briefly again. I apologize, Jenna, our producer. This is the most important question here. Are we likely heading into a shutdown? And can you assure us, or can you tell us when that would happen or when it would not happen?
No, I cannot tell you that. I didn't foresee that we'd have an 8% infection rate in yellow zones 3 weeks ago. So we're heading in a bad direction. This is the reality check. And the fact is, we better change quickly, or we are just on our steps away, perhaps, from an orange zone. We don't have numbers right now. We're going to say that's going to happen. We don't have an announcement from the governor. Nothing is imminent. All we're doing is saying that yellow means caution. That is the caution signal on a traffic signal. Be cautious right now, or else we'll end up in a situation we do not want to be in.
Lieutenant Governor Kathy Hochul, thank you so much for being with us this morning. I guess